my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है.
Okay. I actually had this surgery in the back and voice.
You said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin from Warnal.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You're able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist. I think it's a great view. Yeah. Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist. And today we are after treatment live with Nilesh, and Nilesh was having high pitch voice problem, and we already did his pre-treatment live earlier, and that live we did on December 22nd 2021. So that link we have already given in this live, so please watch that live also. और नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट के बाद लाइव हैं नीलेश के साथ, और आज डेट है 29 जनवरी 2022, और हमने नीलेश का ट्रीटमेंट से पहले वाला लाइव भी ऑलरेडी किया है, और जिसका लिंक हमने इस लाइव वीडियो के डिस्क्रिप्शन में डाल दिया हूँ। और मैं हूँ आपके साथ SLP संजय कुमार, SLP मीन्स स्पीच लैंग्वेज पैथोलॉजिस्ट संजय कुमार, और मेरा एरिया ऑफ इंटरेस्ट है वॉइस डिसऑर्डर का ट्रीटमेंट करना। मैंने अपनी पढ़ाई की है एम्स दिल्ली से, ऑल इंडियन इंस्टीट्यूट ऑफ मेडिकल साइंस न्यू दिल्ली से। ग्रेजुएशन किया है स्पीच एंड हियरिंग साइंस में, पोस्ट ग्रेजुएशन किया है मैंने स्पीच लैंग्वेज पैथोलॉजी फील्ड में यूनिवर्सिटी ऑफ मैसूर से। और आज हम लोग नीलेश जी के साथ हैं। तो नीलेश जी, क्या प्रॉब्लम थी और ट्रीटमेंट के बाद कैसे रिएक्शंस आ रहे हैं लोगों के, बताइए। अनम्यूट कर लीजिए माइक।
हेलो एवरीवन, तो मेरा नाम नीलेश है एंड मुझे हाई पिच का प्रॉब्लम था। मैंने सर के वीडियोस देखे थे तो मुझे पता चला कि इसका ट्रीटमेंट भी है, तो मैंने सर को कांटेक्ट किया था। 22 दिसंबर को मैंने स्टार्ट किया था ट्रीटमेंट, एंड अभी ऑलमोस्ट लाइक 1 मंथ के बाद मेरा वॉइस बेटर है एंड मेरे पास कॉन्फिडेंस आ चुका है। तो अब नॉर्मली मैं जब भी किसी से भी बात कर रहा हूँ तो सब जने अच्छा रिस्पॉन्ड कर रहे हैं, एंड वो लोग पहचान नहीं पा रहे हैं कि मैं बात कर रहा हूँ। पहले वो पूछ रहे हैं कि कौन है, नीलेश से बात हो सकती है क्या। बट जब मैं बोल रहा हूँ कि मेरी वॉइस है एंड दे स्टार्टेड कॉलिंग, वीडियो कॉल करना शुरू करे, तो उनको पता चला अरे वॉइस में फर्क आ चुका है। तो अभी कॉन्फिडेंस आ चुका है एंड अच्छा लग रहा है।
ओके, थैंक्स नीलेश। और मैं आपसे इंग्लिश में भी बात करने के लिए कहूँगा इन चीज़ों को बताने के लिए, लेकिन उसके पहले मैं बताना चाहूँगा कि इस लाइव में हम लोग कुछ पॉइंट्स डिस्कस करने जा रहे हैं, उसके बारे में मैं बता देना चाहूँगा। Nilesh will be talking in English also, and before that we are going to discuss few points in this live, so please be connected with us, and that will be quite informative. And you can mute your mic, Nilesh. So we are going to talk about the high pitch voice sign and symptoms, what the Nilesh was having, and the cause of high pitch voice, and treatment of high-pitched voice we'll be talking. We'll also discuss about the speech production mechanism. Once we'll understand the normal, then it will be easier for us to understand the abnormal. And we'll also talk about what are the other communication disorder for which we provide our services. And I'll be also talking about few tips how to keep your voice healthy. I'll be also talking about how do you know your speech therapist is not a fake speech therapist. He's not a jhola chhape speech therapist. That also we'll be talking. And I'll be also talking in this live where to report about the fake speech therapist and audiologist, because there are many people who are without qualification practicing in our field. So just I want to create awareness. And I'll be also talking about why you should not take treatment from a healthcare PACS. So these are the points we are going to discuss. So Nilesh, just tell in English what exactly problem you had before treatment and how do you feel after treatment?
So I had a problem of high-pitched voice earlier. So whenever I used to talk, there was a high-pitched voice, as sir mentioned earlier. So I've found few videos and I understood that this is something which can be cured easily. So I've contacted sir on 22nd of December, as sir mentioned earlier. So now after the treatment, this is my voice and I feel very confident now. And I really want to thank Sanjay sir again. And the best part is having patience in this. So with the patience, it was really helpful for me, and this has given me much confidence now. So whenever I'm calling my friends now, they're not even recognizing and they're asking me to hand over the phone to Nilesh, which is my name. So they're asking me to hand over the phone to Nilesh, basically. And then they started making video calls and they understood that I am the one who is speaking. So now I feel much confident now.
Okay, thanks Nilesh. You can mute your mic, and now I'll be playing your before treatment live as well. So this was your before treatment. That live we did on December 22nd, 2021.
Yes. So my name is Nilesh and I have a high pitch problem. My voice is high pitch and I have 180 hertz voice decibel. So the main problem is when I usually talk with my clients, they call me ma'am on call, and even if customer support calls me, they call me ma'am.
So I was just playing your before treatment live, and now let's come to the plan, what we did in the beginning of this live. So let's talk about the symptom of high-pitched voice. So if a boy, he has crossed his pubertal age, means after 14 years or 13, 14 years, and if he's talking in a childish voice, or we can say in a feminine voice, girlish voice, that it can be a symptom of high-pitched voice. And if he is a pubertal age, we can say puberphonia. But if the pubertal age is not there, so technically it's not good to tell puberphonia. And the high-pitched voice symptoms also can be recognized very easily. When you call on the phone, many times people will say yes ma'am, or sometimes they will say yes ma'am, and you are a male, and when you are calling on the phone, sometimes patient says to me, सर मैं जब सामने होता हूँ तो लोग मुझे सर कहते हैं, लेकिन फ़ोन पर मेरी आवाज़ पतली आती है तो उसी समय लोग मैडम बोलते हैं, तो मेरी आवाज़ सिर्फ फ़ोन पर ही पतली हो जाती है। पतली फ़ोन पर भी रहती है और फिजिकली जब प्रेजेंट होते हैं तब भी रहती है। प्रॉब्लम ये होता है कि आपकी दाढ़ी मूछें या और एक मेल का जो चेहरा है उसकी वजह से लोग सर बोल देते हैं, और फ़ोन पे जब आप बात कर रहे होते हैं फ़ोन पर तो वो लोग आपकी चेहरा को नहीं देखते हैं, आपकी दाढ़ी मूछें नहीं देखते हैं, तो वो लोग मैडम बोल देते हैं। तो वॉइस और वोकल कॉर्ड्स वही होती है। तो मैं जस्ट अवेयरनेस के लिए बताना चाह रहा था। तो कहने का मतलब कि प्यूबर्टी के बाद एक जो लड़का है उसकी आवाज़ जो है वो एक मोटी हो जानी चाहिए, जब नहीं होती है तब फिर ये प्रॉब्लम है हाई पिच वॉइस का, और अगर प्यूबर्टल एज में है तो हम प्यूबरफोनिया भी कह सकते हैं। और अब हम लोग बात करेंगे ट्रीटमेंट ऑफ ये कॉज ऑफ हाई पिच वॉइस। हाँ, तो हाई पिच वॉइस के कारण क्या हो सकते हैं, तो इसको समझने के लिए हम लोग थोड़ा सा स्पीच प्रोडक्शन मैकेनिज्म को भी समझेंगे, और उसमें इसके अलावा भी कई सारे कारण हो सकते हैं। स्पीच प्रोडक्शन मैकेनिज्म को समझने के बाद कई बार हार्मोनल इश्यूज भी हो सकते हैं रेयर केस में, और प्रकृति ने वोकल कॉर्ड का मास लेंथ सफिशिएंट नहीं दिया, नेचर हैज नॉट गिवन द सफिशिएंट मास एंड लेंथ ऑफ द वोकल कॉर्ड, ए कंडीशन कॉल्ड sulcus vocalis. In that case also high pitch voice can occur, and there can be situation where nature has given the normal vocal cord but you are not using it in an effective manner. What was the case of Nilesh? So we stimulate the vocal cord in a most effective way and the pitch reduces. So that we do in the treatment of high pitch voice. So depending upon the reason, the plan of treatment may varies. So all high pitch voice patients are not exactly the same, and for all high pitch voice patient, treatment is not the same way. Suppose some patient will be having phonatory gap with a high pitch voice, their treatment method will be different. So proper assessment from a certified speech language pathologist is very, very important to understand the problem. And sometimes we require the laryngoscopy. So once we do the perceptual evaluation, we suggest that. And speech production mechanism we'll talk. So that will be give us an idea what is the reason of this high pitch voice, especially when the vocal cords are normal, and what we do in the speech therapy and the treatment of high pitch voice. So for the speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put the air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you want to say "p," both the lips are coming closer together in touching each other. When you want to say "th," tongue is coming between the teeth. When you want to say "k," back up, the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. When you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord. Vocal cords move, sound generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound has its own place, own manner of articulation. So it is little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles will not be there, there will be fluency issue. That can be seen in case of a stammering. There will be place of articulation will be wrong, manner of articulation will be wrong. There will be pronunciation problem. For example, you must have seen some children. For cat, they will be saying tat. For ram, they will be saying lam. So there is a problem in the place of articulation and manner of articulation. And let's concentrate what Nilesh was having the problem. Nilesh's vocal cord, based on my assessment, were absolutely normal. But he was talking in a feminine voice, or we can say childish voice. The reason is during puberty, mass of the vocal cord, length of the vocal cord increases due to a hormone called testosterone. This occurs in all boys. And even that happened in the Nilesh's case also. But because Nilesh spoke from childhood to puberty in a high-pitched voice. So during puberty, vocal cord mass increased, the length increased. So the vocal cord was ready to produce the low-pitched voice. But because of so many years habit, he was not able to accept the new voice. So to maintain his childish voice, even the vocal cords became thick. Earlier, vocal cords before the puberty will be a kind of thin string-like structure. But during puberty, due to the testosterone hormone impact, it will become like a thick string of a guitar. So ideally the voice should be low pitch, but Nilesh was speaking from childhood to puberty in a high pitch voice, and during puberty mass of the vocal cord, length of the vocal cord changed. The vocal cord was ready to produce the low pitch voice, but because of so many years habit, he tried to maintain the childish voice. To do that, what he did, his vocal cord was normal, thickness was normal, but he wanted to produce the high pitch voice because of the so many years habit. So instead of vibrating the whole mass and the whole length of the vocal cord, he was vibrating only thin edges of the vocal cord. So the vocal cord was actually thick but behaving like a thin string of a guitar. So that's why the pitch was higher. So what I did in the voice therapy, in fact by online voice therapy, with a certain vocal exercise, I stimulated whole mass and the whole length of the vocal cord. So earlier only thin edges were vibrating the vocal cords. Now the whole mass and the whole length are vibrating. So the vocal cord started behaving a thick string of a guitar like a structure. What exactly it is. So the pitch reduced. But don't think that all the high pitch voice are the same. There are some healthcare quacks will also be treating and they will think that all the things are the same. But if you do the wrong vocal exercise, it may damage the vocal cord sometime, because in the sulcus vocalis, nature has not given the sufficient and mass and length of the vocal cord. So in that case, the plan will be slightly different, and there will be phonatory gap also. In that case, we need to bring the vocal cord closer together so that we can reduce the phonatory gap. In that case also we have seen the high pitch voice, and there are certain cases where the vocal cords will be normal. So in that case the plan of treatment will be different. So that was I was discussing about the speech production mechanism. And next is what are the other communication disorder for which we provide our services. To understand that, I will suggest please refer our YouTube channel's playlist. In that, you will find different communication disorder, and all the playlists will be having pre and post treatment videos. For example, once you explore our YouTube channel playlist, you will find the videos and the playlist of puberphonia, high pitch voice, vocal cord paralysis, stammering, functional aphonia, functional dysphonia, phonatory gap, sulcus vocalis, spasmodic dysphonia, like aphasia, which happen after the stroke, misarticulation, and after hearing testing, and once we fitted the hearing aid machine, how the communication improved. So that also video will be fine, because I'm an audiologist and speech language pathologist both. My bachelor degree is in speech and hearing science. So based on that, I'm a speech language pathologist and audiologist both. But my master degree in speech language pathology. And my area of interest is treating speech and voice disorder. And so these are the way how we can understand what are the other services provide for different communication disorder. And next is a few tips how to keep your voice healthy. This is helpful for everyone, like those who are having communication problem and those who are not having the communication problem. So drink plenty of water. Water is a very, very good lubricant. So once you drink plenty of water, there will be less friction while speaking in the vocal cord, and that will help you, especially if you're a professional voice user like a singer or teacher. So that proper lubrication will support your vocal cord. And I have seen sometime teachers will develop the vocal nodule, but if you're drinking plenty of water, the friction will be less. So that will help you to not to occur the vocal nodule. And next is, if you are a teacher and if you are speaking to a big classroom, you use the amplification device. Ask your management to provide the amplification device. And when you do the frequent throat clearing, like very frequently, there will be a lot of friction between the vocal cord and it may damage the vocal cord. So avoid the throat clearing. And if you smoke, there is a chances of developing the vocal cord polyp. So there will be one structure will develop on the vocal cord, and because of that, there will be gap in the vocal cords. The voice become really hoarse because the two vocal cords will start now in different frequency, because one vocal cord is suppose having different mass, other is having different mass. Based on the acoustics, you must have heard the formula N is equal to 1 by 2L under root T by M. So here mass of the vocal cord will change because of the polyp. So the frequency of the vocal cord will be different. And when the vocal cords will not be in unison, then there will be hoarseness in the voice. So avoid the smoking and throat clearing. Drink plenty of water. Too hot and too cold things are not good for voice. So you can avoid if you want to keep your voice healthy. And you can also do some physical exercise, jogging, running, yoga, or going gym and all. That will make you active, and that will also support your voice and the vocal cords. So these are the few, and most important thing is avoid shouting. Shouting is a vocal abuse. Sometimes patients think shouting is a vocal exercise. Wrong. Shouting is a vocal abuse, and it may damage your vocal cord. So avoid that. And if some healthcare requests are suggesting shouting as a voice therapy technique, please don't do that. And I'll give you an example. Like the boy, there is one live we have done. Yeah, on December 24, 2021, we have done one live. Please watch that video. This guy was having high pitch voice, and for that he went for the treatment, and the person who gave the voice therapy was not a speech language pathologist. Asked him to shout and all. After shouting, his vocal cord paralyzed. So just watch this story. Again, I'll repeat, December 24, 2021, we have done one live, pre-treatment live. So voice therapy is not a joke. Anybody without training can give, and you can see the result, how his vocal cord paralyzed. He went for the treatment of high pitch voice, and now he's struggling to treat the vocal cord paralysis, and he has contacted with me for treatment of vocal cord paralysis. So, and next was like, how do you know your speech therapist is not a fake speech therapist? अभी सोशल मीडिया का ज़माना है, बहुत सारे झोला छाप अपने नाम में स्पीच थेरेपिस्ट लगा देते हैं बेरोजगारी की वजह से। किसी स्पीच थेरेपिस्ट के पास गए, रिलेटिव को लेकर देखा टेक्निक क्या अपनाया, बस वो घर पे जाके पड़ोसी के साथ अपनाए, गलती से ठीक हो गया तो यूट्यूब पे वीडियो डाल दिया और अपने आप के नाम में लगा दिया स्पीच थेरेपिस्ट। तो ऐसे नहीं होता है। मुझे भी बहुत सारी चीज़ें पता है। मैं भी अपने रिलेटिव्स को कई बार फिजिशियन के पास लेके जाता हूँ, तो मैंने देखा है कुछ एंटीबायोटिक्स मेडिसिन देते हुए, एंटी एलर्जिक, एंटासिड। तो मैं कल को अपने नाम में जो है फिजिशियन लगा करके और मेडिसिन देना शुरू कर दूं और फिर कहूँगा अरे फिजिशियन के पास गए थे तो इतना फीस लिया था, मैं तो फ्री में, मैं तो कुछ ही रुपए, 10 रुपए में ही मैं तो लिख। तो वो फिजिशियन बनने के लिए कितने साल अपनी पढ़ाई और कितना टाइम इन्वेस्ट किया था, और वो एक प्रॉपर रीजन को समझ के ट्रीटमेंट देगा। झोला छाप है, वो किसी का पर्ची पढ़ के देगा, तो बहुत चांस है कि झोला छाप जो है ज़्यादा को बर्बाद किया और एक आध को बचाया, और उस एक आध को बचाने को आप डॉक्टर नाम उसको नहीं समझ सकते, और उसके फीस को एक जो प्रॉपर फिजिशियन के फीस से आप तुलना नहीं कर सकते। तो कई बार मेरे कमेंट बॉक्स में आते हैं, बोलते हैं सर आपकी फीस ज़्यादा है और कई XYZ तो फ्री में और कम पैसे में ठीक कर रहे हैं। वो XYZ झोला छाप है जो किसी का नकल करके कहीं से कर रहे हैं और कितनों को खराब किया उसका डेटा नहीं। अब तो मेरे पास डेटा आना शुरू हो गए हैं झोला छाप के। वोकल कॉर्ड पैरालिसिस वाले आ रहे हैं, फोनेटरी गैप वाले आ रहे हैं, वोकल नॉड्यूल वाले आ रहे हैं जो झोला छाप से एक्सपेरिमेंट करके आ रहे हैं। तो इसलिए आप कभी भी तुलना मत कीजिए एक प्रोफेशनल का एक झोला छाप से, आप उसकी तौहीन कर रहे हैं। क्योंकि किसी भी गवर्नमेंट इंस्टीट्यूशन जैसे ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंस न्यू दिल्ली में जाने में भी काफ़ी मेहनत करना पड़ता है और फिर उसके बाद पढ़ाई करना पड़ता है, फिर क्लिनिकल स्किल डेवलप करना पड़ता है। झोला छाप तो किसी एक का पर्ची देखेगा फिर उसके बाद ट्राई करेगा, गलती से ठीक हो गया तो अपने नाम में स्पीच थेरेपिस्ट डॉक्टर लगा के जो अपना लोगों को बताएगा कि मैं कम में इलाज कर दूंगा, लेकिन कितनों का खराब किया इसका डेटा आपके पास नहीं है। ऐसे लोगों से बचिए। और अब आती है वेयर टू रिपोर्ट फेक स्पीच थेरेपिस्ट एंड ऑडियोलॉजिस्ट। तो रिहेबिलिटेशन काउंसिल ऑफ इंडिया जो है वो गवर्निंग काउंसिल है। अगर कोई फेक स्पीच थेरेपिस्ट झोला छाप के लोग प्रैक्टिस करते हैं और किसी भी तरह का नुकसान पहुंचाते हैं तो आप रिहेबिलिटेशन काउंसिल ऑफ इंडिया को रिपोर्ट कर सकते हैं। रिहेबिलिटेशन काउंसिल ऑफ इंडिया गूगल सर्च कीजिए, वहाँ पे ईमेल आईडी मिलेगा, उस ईमेल पे आप मेल कीजिए। जो है RCI स्ट्रॉन्ग और लीगल एक्शन लेती है ऐसे लोगों के अगेंस्ट में। और फिर लास्ट क्वेश्चन था व्हाई यू शुड नॉट टेक ट्रीटमेंट फ्रॉम हेल्थ केयर पैक्स। तो इस पॉइंट को मैंने डिस्कस किया था ऑलरेडी कि मैंने एग्जांपल दिया था इनका, जो मैंने 24 दिसंबर 2021 को लाइव किया था कि कैसे हाई पिच वॉइस वोकल कॉर्ड पैरालिसिस में कन्वर्ट होगी। इस वीडियो को आप लोग जरूर देखिएगा, ठीक है। और अब हम लोग इस लाइव को स्टॉप करेंगे। अगर कुछ क्वेश्चन होगा तो मैं देख लेता हूँ एक बार, क्योंकि मैं थोड़ा सा प्लान करके, बहुत सारे एक कॉमन क्वेश्चन आते हैं हमारे लाइव में कि सर आपका एड्रेस क्या है। सॉरी स्टक हो गया मोबाइल में क्वेश्चन देखना से। हाँ सर आपका एड्रेस क्या है। तो मेरा एड्रेस जानना बहुत ही आसान काम है। हमारे किसी भी वीडियो के आप डिस्क्रिप्शन में जाइए। जब आप डिस्क्रिप्शन में जाएंगे तब आप हमारे वीडियो के, तो उसमें हमारा वेबसाइट मिलेगा। वेबसाइट पे क्लिक कीजिए, रीच मी, फिर गूगल मैप पे हमारा क्लिनिक कहाँ पे सिचुएटेड है वो भी दिख जाएगा, ईमेल आईडी भी मिलेगा, कॉन्टैक्ट नंबर भी मिलेगा, तो सारे डिटेल्स मिल जाएंगे। और फिर लोग पूछते हैं सर ट्रीटमेंट कॉस्ट क्या होगा, तो वेरी करता है, डिपेंड करता है कम्युनिकेशन डिसऑर्डर क्या है, तो उसके बारे में हम जानकारी देते हैं परसेप्चुअल इवोल्यूशन के बाद। और कभी कभी हम लोग लैरिंगोस्कोपी या स्ट्रोबोस्कोपी टेस्ट कराने के बाद इन्फॉर्म कर पाते हैं। तो अब मैं आप लोगों के क्वेश्चन को पढ़ पा रहा हूँ। अगर कुछ क्वेश्चन है तो मैं थोड़ा बहुत आंसर करने की भी कोशिश करूँगा। अभी थैंक्स फॉर यूनिक थिंक फॉर ज्वाइनिंग एंड वॉचिंग एंड थैंक्स। इनका क्वेश्चन है सर मुझे पियरफोनिया की प्रॉब्लम है, प्लीज़ हेल्प मी सर। तो एक चीज़ मैं यहाँ पे कहना चाहूँगा, कई बार पेशेंट खुद डायग्नोस कर लेते हैं मुझे पियरफोनिया है, मुझे ये है, XYZ प्रॉब्लम है। जब मैं असेसमेंट करता हूँ तो कुछ और प्रॉब्लम निकल के आती है। तो मैं चाहूँगा कि असेसमेंट वाला काम जो है मुझे भी दे दीजिए। पहले मैं सुनूंगा, आवाज़ समझूंगा, फिर मैं बताऊंगा कि क्या प्रॉब्लम है, फिर उसके अकॉर्डिंगली मैं गाइड कर पाऊंगा। पेशेंट खुद बोलेगा कि सर मुझे X प्रॉब्लम है, जब मैं असेसमेंट करता हूं तो Y प्रॉब्लम निकल के आती है। तो सबसे पहले तो ये बात है कि सारी पतली आवाज़ पियरफोनिया नहीं होती है। पियरफोनिया होती है प्यूबर्टी में। कोई 30 साल का आदमी है, उसको पियरफोनिया हम कैसे कहेंगे? उसको हम हाई पिच वॉइस कर सकते हैं, स्ट्रिल वॉइस कर सकते हैं। और जब मान लीजिए किसी की वोकल कॉर्ड प्रकृति ने पतली दिया है, जिसको हम बोलते हैं कंडीशन सल्कस वोकलिस, उस केस में भी पतली आवाज़ होती है, तो हम पियरफोनिया उसको नहीं कर सकते हैं। फोनेटरी गैप में भी मैंने देखा है पतली आवाज़ होती है, तो हम उसको पियरफोनिया नहीं कर सकते हैं। तो पतली आवाज़ मतलब सारे पतली आवाज़ पियरफोनिया नहीं होती है, इसको समझना बहुत ज़रूरी है। और so thank you everyone for joining and watching us. Or Nilesh will stop this live, and at the end I want to thank you so much for supporting me by creating by helping me, and you came in this live and you supported me, and my idea is to create awareness, and with the time you will get more confidence and your voice will become more smooth also. So Nilesh, yeah, at the end you just summarize your problem and how do you feel now?
Okay. So everyone, I had a problem of high pitch. So whenever I used to talk, there was a high pitch problem. So usually I'm a web developer. So I design website for my clients. And whenever I used to talk to the clients, they used to call me ma'am, and they used to call me, like, they used to think I'm a female. As I was on call, I was not in person with them. So after the treatment, now I'm so confident, and when I talk to people, they are not recognizing me when I call my friends and family. But like now, as a result, when I'm talking to my clients, they are referring me as a man, but not as a female. So that's the best part, and I really want to thank Sanjay sir again for making me go through all the process and the treatment, which helped me have my voice better and get more confidence in me. And basically, all suggestions which I give from my side after this treatment is invest as much as you can, as much as time as you can do in this process, which would help you have a good voice. And having more patience is the next best thing to have while this treatment. So in case if you are uh, trying to do this treatment from sir, I suggest you having these things would help you and make your voice more better. And I wish all the best for everyone who is doing this treatment who has such problems, and this would help a lot. So I again want to thank Sanjay sir again for helping me go through this process.
Thank you so much, Nilesh, for telling your experience and for your wishes to other patient. Thank you so much, and we'll stop this live. Thank you all. Love you all.